Hi guys, we're Group 7 and these are the diagnostic processes in periodontics. But first, let's start with answering the question, what is the importance of diagnostic procedures? Diagnostic tests are there for us to know exactly what condition or disease the patient is suffering from. By knowing that, then we can come up with a good treatment plan before the condition can worsen or progresses any further. And we also know the prognosis. The first and most important step in a treatment of a patient is getting a full history, starting off with the chief complaint, which consists of a brief statement in the patient's own words concerning his reasons for seeing the dentist. After that, we get the history of present illness, which is a detailed description of the patient's current problems written in chronological order. Next is the past dental history. In this step, we record the patient's attitude towards previous dental treatments and the frequency of past dental visits. We also need to record the names and phone numbers of all the dentists that treated the patient. After that, we get the past medical history. This is important because there are many medical problems that have a significant effect on dental treatment. But also, there are a lot of dental conditions that are related to systemic disorders.
We're going to perform extraoral and intraoral examination on our patient. First, we do the extraoral examination by checking the facial symmetry of the patient and check for any skin lesion on the face. We also palpate for the lymph nodes on the submental, submandibular, and cervical lymph node of the patient. There should be no swelling. And then check for the TMJ for pain and clicking sounds. Then after that, we do the extraoral examination by checking the soft tissues of the upper lip, the lower lip, and then the soft tissues inside the oral cavity. Check for possible lesions. And then, by using the tongue depressor, we check the tongue for swollen uvula and other soft tissues. And then, don't forget to check the teeth also, of course. And everything is good. It's good.
Miss Joanne Balmonte and I will be performing percussion and palpation. First, I'm gonna do percussion. Percussion is done by tapping the tooth. It is done by first tapping the contralateral and opposing tooth before the offending tooth. Percussion is done to determine if there is already periodontal ligament inflammation. Next would be palpation. Palpation test shows if the inflammation has already reached the periosteum.
This procedure is called periodontal probing. A periodontal probe is inserted into the periodontal pocket. The pocket depth is measured on each surface of the tooth by walking the probe around the tooth. In a healthy mouth, the pocket depth is usually between 1 to 3 millimeters. If the pockets are deeper than 4 millimeters, this may indicate periodontitis. In advanced stages of periodontal disease, the gums may start bleeding when they are probed.
For bite testing, use a bite stick. Ask the patient to bite on the offended tooth, contralateral, and adjacent for comparison. Ask patient to raise her hand if pain is felt upon biting. Check also for presence of cracks while performing the test. In checking mobility, do not use your hands because it will not be reliable. To get the accurate result, use two instruments with blunt end. One instrument on the lingual aspect and the other on the facial aspect. Push up with one, then down with the other. First distinguishable sign of movement greater than normal is +1. Horizontal movement greater than 1 mm is +2. Anything greater than that, with or without visualization of rotation or vertical depressibility, is +3.
So, radiography is very important in diagnosing a periodontal condition, but it should not be limited to radiographs. So, the importance of radiographs is to see the amount of bone present, the condition of the alveolar crest, the periodontal space, and we can also see the root length and the different anatomic and pathologic consideration. So, for today, we'll be talking about the periapical radiography. So, in periapical radiography, we use this machine to take radiographs of individual tooth. We have this for the patient, and this is important because it is used for the detection of the apical infection or inflammation, assessment of the periodontal status, assessment of the presence and position of the tooth, and the like. So next, we have the panoramic x-ray. So next, we have this panoramic x-ray machine. So this is used with the patient biting in a bite block for a proper alignment, and then there's a rotating arm that would take the radiograph for 12 to 20 seconds. This is also an important diagnostic tool that can reveal advanced periodontal disease, cysts in the jaw bones, jaw tumors, impacted tooth, jaw disorders, sinusitis, and many more. So in panoramic x-ray, you will see the whole dentition, while in periapical radiography, you will see the radiograph of an individual tooth. And other types will be discussed by my classmate.
Bite-wing radiograph is used to detect interproximal decay, also provides some information on the patient's periodontal status. The patient is positioned with the head supported and with the occlusal plane horizontal. The holder is inserted carefully and the patient is asked to close the teeth firmly together onto the bite platform. The X-ray tube head is aligned using the beam aiming device to achieve optimal horizontal and vertical angulation. Next is the cone beam computed tomography. It is important application that allows for the analysis of the buccal lingual surface and improve visualization of the depth, height, and morphology of the defect. First, instruct the patient to sit in the exam chair. The dentist will position the patient so that the area of interest is centered to the beam. Instruct or ask the patient to remain very still while the X-ray source and detector revolves around the patient for 360-degree rotation or less. This will typically take between 20 to 40 seconds.
So those are the diagnostic procedures that will help us in diagnosis and treatment planning for periodontal diseases. Once again, we are Group 7.